Center for Management of Healthcare Services at IIM Ahmedabad webinar series on the future of e-pharmacies in India. I am Professor Chirantan Chatterjee, who is the chairperson of the center. And today we have a pretty interesting panel here. We have Amrita Agarwal from the Bill and Melinda Gates Foundation, who leads the Health Systems Design program there. Joining Amrita will be Dr. Ajay, who is the Dr. Ajay Nair, who is the Chief Executive Officer of Swasth, and Dr. Deepu Sebin, who is the CEO and co-founder of Daily Rounds. We would get fresh clinician perspectives along with digital efforts that are happening in healthcare as it blends into the e-pharmacy evolution in India. We have two entrepreneurs with us, Santosh Kumar Panda and Mr. Gopal Panigrahy, who are running PlusPin Healthcare in Hyderabad region. And they basically use a technology-based platform to interface with pharmacists. So their perspectives would be quite valuable. And we then have Mr. Sanjay Jesrani, who has been an investor and a founder and CEO of Go North Ventures in this ecosystem. So it's a pleasure to have him and listen to his perspectives from the investorial side. And then finally, we also have Mr. Dr. Santanu Chattopadhyay, who is probably not yet with us, but would soon be probably with us. But he's the head of hospital and provider business from 1mg. And we would love to know it from the horse's mouth on how the e-pharmacy story is going. Thank you everyone for joining in. And as promised, I think, let me just set the context by taking a couple of minutes on what's happening to e-pharmacies in India. So as I see it as a health economist, obviously we have the recent happenings of acquisitions that have happened with NetMeds and with Amazon's entry in e-pharmacy, but this has been in the works. E-pharmacies have been in the works in India for the last 5 to 10 years. It was a local event initially. So if you go to traction data on venture capital tracking platform, um, you will see that there are more than 100 e-pharmacies that have cropped up in various regions. Not all of them have the scale of being accessible throughout the country. And also there's a history here. So pharmacists as an ecosystem in India have a national as well as a regional history. So we have the All India Organization of Chemists and Druggists and their various state chapters who interface with pharmacists and retailers in the distribution of medicines in the country. But we also have competing state retail level association, whether it's in Kerala or Odisha, and then entry by private pharmacist chains like MedPlus. There's research to show by Dan Bennett from the University of Southern California that as more and more entry has happened, this has led to a welfare enhancing average price effect and choice effect that is potentially beneficial for society at large with entry. But that's more on the brick and mortar side. We don't yet have any evidence to see whether e-pharmacists are enhancing patient welfare in the country. This is my overall take. And of course, there is a regulatory, I would say, regulatory evolution that is happening over here. A lot of pharmacists face this challenge of basically validating prescriptions from physicians, and there is a pushback that has also happened through the regulatory ecosystem on whether they should be at all allowed to operate in the market. So with that as a perspective, we thought in the summer of this year, as the lockdown happened with COVID-19, we will go into a certain ecosystem and see what is happening to the life of the average pharmacist. And with that, we did from the Center for Management of Health Services and with PlusPin, a pharmacist survey. And our agenda would be to request Santosh and Gopal to come in and share what they found from the survey. And I, of course, joined in as a researcher. And then turn to Mr. Jesrani and Mr. Chattopadhyay on their perspectives around digitization, entrepreneurial and investorial thoughts around the evolution of the sector. After that, we are going to go to Amrita Agarwal for her thoughts with the health systems lens on this digital evolution of the pharmacist ecosystem, but more broadly, Indian healthcare at large, because there is also a private versus public horse race that is going on, which will have an implication for patient welfare tomorrow. I will then like to turn back to two doctors who are now entrepreneurs, Deepu and Ajay, who have joined us from various regions of the country to get the clinician perspectives. And they also have experimented, they have been on the field, they have attended to patients themselves, looked at how medicines get distributed. So it would be nice to know their perspectives. And having done all of that, I'll summarize all the thoughts and try to wrap up in the last 5 minutes of the webinar within 45 to 50 minutes, coming back to open questions. The audience is requested to float their questions in the chat on the Q&A window on the webinar. And now we can roll. So Santosh and Gopal, maybe a line about you and your company and what we did with the survey for about 10 odd minutes. Over to you.
Sure. Thank you, Professor, and hope I'm audible to everyone else, right?
You are. Please go ahead.
Great. Yeah, sure. And warm good evening to everyone, and thank you, Professor Chirantan and the team at IIM-Ahmedabad. So it was definitely a phenomenal experience for us to work alongside with the team to understand the specific sector for which our startup has been working for the last 3 to 4 years, and understand a little more insight about the retail chemist's mindset, right? Just to give you 2 minutes about our startup. PlusPin Healthcare is a digital platform which we're creating so that we can enable the retail pharmacies. Now, if you see, India has close to 1 million retail pharmacies. These are all the mom and pop stores, small chains, mini chains. So these are basically the brick and mortar stores which has been serving the Indian population for last several decades in terms of fulfilling their prescription, be their counselor whenever there is a health ailment, guiding them for whoever is the nearest good doctor to go by and all. So this is something they had been doing for quite some time. Now, that is why when we started 3 years ago, we thought that this is one area which definitely has a scope of digitization and can grow pretty fast. And that's why PlusPin aims at bringing them onto a platform so that we are able to give them a fair level field whenever they are willing to compete or partner with the e-commerce space of the pharmacy segment, which was uprising at that point of time. And I would say like the 3 years had been a journey in the right direction where we saw the expected growth of e-pharmacy space in India, all the interest which is being generated by the big e-commerce players in getting a pie into this space, talk about Reliance, talk about Amazon, now talk about Flipkart, who is also having some active interest in the 1mg as a e-pharmacy player. So this sector has definitely grown faster. And at the same time, the retail chemist or the pharma body is also facing the heat. So all these things put together, when we got into the unfortunate phase of the lockdown being imposed in March or April, so this gave us a unique point where, if you see, the pharmacy was declared as one of the essential services segment. So while the entire nation was going on shutdown, the pharmacists were required to keep their shutters open. They were required to service the customers. They were required to service the business. At the same time, there were a lot of logistic challenges which was not working in favor of anybody who was probably working on a delivery-based model, right? So all these things were at hand when Professor Chirantan approached and tried to understand what is it happening in this segment, and he wanted to know my viewpoint. So that's what he said, like, why don't we basically hear it from the horse's mouth, and then why don't we take this thing to the pharmacies and then to the pharmacists and understand their viewpoint. So that's the context of this entire survey. I'll also quickly ask Gopal to introduce himself before I jump into the slide and findings to be presented to the broader audience. Over to you, Gopal.
Yeah, thanks, Santosh. Good evening, everyone. Thank you for being here, and thank you, Professor Chirantan, for this opportunity to talk about what we do and what else is there in future for the entire ecosystem to be. Like Santosh gave a gist of like where do we stand today in terms of engaging with the pharmacies. The most interesting aspect is that the opportunities that lies in actually. So I would not take much time, but hand over back to Santosh again because we will talk about when we explore the survey, the underlying opportunities that sit in, and then probably that would nicely turn into the entire panelist to bring their thoughts in, and then we can talk about more once we have everyone's inputs coming in. Thank you. Yeah, over
sure.
to
Thanks,
Santosh.
Gopal. Hope everyone is able to see my screen now.
Yep. And Santosh, we have 7 more minutes
Yeah,
for your
great.
allotted 10 minutes. I have to play the professorial hat
Yes.
and keep time discipline.
Yes.
Sure.
Sure. So I think just quickly to take a look at the survey methodology, if you see, we had worked with IIM Ahmedabad, a couple of researchers and professors to come up with a comprehensive questionnaire, which we then ran across 196 pharmacies in Hyderabad. And the pharmacists were chosen depending on several factors. So for example, the size of the store, the number of years they have been in business, what has been their annual turnover, what is the kind of the consumer base and all. And then we were trying to assess a few of the key things, which are basically how this entire thing has impacted the business for the retail pharmacy, how it was also impacting the e-pharmacy, and then what was the synergies these two segments were trying to find. So this is basically was the agenda for running it. Was impacting the business stores which were operational at that point of time. Most of them have reported that the average business was dropping at that point of time, and pretty much self-explanatory, because there was lockdown, people were staying indoors. Most people were not allowed to go out of their containment zones and all. Hence, most of the stores were showing that the business definitely dropped around 40 to 50%. In fact, there are a few stores which reported a 100% decline in the business because their location or the restrictions in that area forced them to probably shut down or put the shutters down. A quite example could be that the pharmacist might be staying in a remote place or a distant place from the shop where he's running the business. But there were 10% of the pharmacies who in fact reported that there was no impact to the business, and that was interesting because what these 10% of the pharmacists were doing different so that they did not have any impact. When we deep dived into it, the first and foremost thing which we figured out is that most of them had reported that there was a surge in the bulk purchases during the lockdown phase, which basically compensated for the lost revenue. I know, like, everybody was panic buying all the from groceries to essentials, even to liquors. People were basically stocking it up for the rainy day, right? So I think this has also helped some of them. The other factor was it also was directly correlated to the education level of the pharmacists. Now, just to give you, all of us might assume that all the pharmacists are E-Pharma or B-Pharma educated, but I think on the ground, that's not the reality. Most of the stores are run by a B-Pharma or D-Pharma graduate, but then the entire operation is being held or is being done by probably somebody, friend, family, kin, and that person's education qualification definitely mattered here. Now, if you say most of the people who reported no impact to the business were graduates and above, and the people who were basically maybe intermediate or maybe other streams and all, they reported that no, their business had impact. The other factor was, if you see, all the businesses which did not have much of an impact were finding ways to constantly engage with their customers regularly. They were in touch with the customer during this phase. In fact, some of them enabled doorstep deliveries to counter any of the challenges in terms of handing over the medicine to the patient. And this, in fact, boosted their reputation, because this was also a time frame where even e-pharmacies were struggling to deliver goods at the doorstep of the customers.
Santosh,
Then switching
one
to the
quick
other side,
point. We have about 4 more minutes. You may want to give the headline items of every slides and complete the slides instead of going into the details.
Sure.
And we can circulate the slides with our
Sure.
participants and panelists.
Right.
Yeah.
Sure. So the other segment which we tried to find out was basically the impact on the supply chain, and then definitely 80% of the pharmacists were complaining about a supply chain disruption, and it was mostly because of either the supply was delayed, the stock was not available, and the distributors were not able to deliver it on the doorstep. Right. This has given an opportunity for some new solutions to come up, which can basically disrupt the supply chain segment of this entire space. Maybe they want to do digital procurement. So there is definitely scope increased for people who wants to work on that segment of disrupting the supply chain business for this kind of segment. Right. The other behavioral changes which observed was that 90% or 87% of the pharmacies were keeping a database of the people who were coming with flu and fever symptoms, and this was in line to the government directive. However, some of them were not doing it, and then the correlation between the two was again clearly reflected in the qualification. pharmacists who are qualified in the right stream and all were more adhering to the guidelines and everything which is provided by the government, and then they were doing it. Similarly, from the uses of Arogya Setu app was also clearly correlated to the qualification and the pharmacist's years of operation under this. Most of these pharmacies also found ways to collaborate within the community. I mean, like if you see, all the pharmacists are a close-knit community, they have their associations and all, right? They found ways to collaborate among themselves to find out how they were maintaining, how the other store is maintaining social distancing norms, how are the structural changes they are doing for the stores, how is the stock availability happening, how are they getting the stocks fulfilled, what are the different digital payment options is being done. So there is a strong, I would say, collaboration within the community. So if they are facing a challenge, they are actually collaborating to overcome the challenge. Now, after all this, if you see, when we probably pitched a question, we think that, do you want to evolve yourself? Then if you see, most of the stores are willing to, are having an interest level to make different alterations to the physical alterations to the store, so that the social distancing norms are maintained, people feel safe to shop and all. And then this also particularly had a direct correlation with the number of years of pharmacy in business. The pharmacy, which is probably operational for last 2-3 decades, was more reluctant to do physical alterations, whereas the pharmacists who are probably new in the game are more willing to do the physical alterations. The same effect is from educational background also.
About
Now,
1.5 more minutes.
Going for, yeah. Sure, Professor. So going forward, I think the pharmacists are also seeing that there's no clear-cut direction for them from the government. They feel that what they have to figure out how to basically wait the storm and then move out next. Only 10% of the pharmacists are opting to improvise the customer base by using adoption of technologies. Only 6% of them are also opting to trying to find out ways to home deliver products or to help the customers in fulfilling the requirement. Then there are few pharmacies who are willing to open up newer healthcare facilities within the pharmacy, which basically is a DC pharmacy space. Now, this while we assessed all of these, one question which we basically put forward them is that, do you want to probably go the e-pharmacy model, wherein you want to collaborate with the e-pharmacy or convert your store into e-pharmacy channel so that people can shop online? But I think most of them had a strong negative bias towards probably associating with the e-pharmacy model. And I think the common two reasons which were pointed was that fear of losing out customers to e-players. All of them give an example of Amazon saying that, okay, fine, the players might take away my customers. That was one of the key concerns. Then the second was basically the fear of going out of the business, because deep discounting, better SKU availability is not who but can do. And so this is probably one of the areas, the two key reasons why these pharmacists were not very keen on getting into e-pharmacy model. But one area where they were interested was that, can this be a hybrid model wherein the brick and mortar store will have a digital presence, and they can also be converted into some sort of a wellness store so that they are able to give more value-added points to the customer so that the customer stickiness increases. So I think almost 87% of them had a positive attitude towards converting their pharmacy into a digital wellness center. They are open for adopting technology so that they can now maintain customer databases. They actually ask for solutions where they get the kind of things they are looking at. They're also trying to see if they can provide a basic vitals check or maybe basic diagnostic things at the on point for the consumers. They also want to have more tools in their hands so that they can act as a trusted counselor for the healthcare need of the consumers, right? And of the 87% pharmacists who were having this kind of interest, all of them had better educational background. All of them had witnessed a customer loss or business loss during this phase. All of them had experienced supply chain. And they have used, but one thing is they have used some sort of a basic communication to stay connected with customers and suppliers. So I think these are the characteristics which indicated the pharmacy is more interested to convert it into a digital pharmacy model.
Santosh, I'll take
is
it over from you.
What the pharmacist is expecting out of this entire exercise.
Santosh?
Sure, Professor.
I'll take it over from you. I
Yeah, over
think
to you,
in the
Professor.
end, what they communicated to us is that they felt they are being left out in the ecosystem and they wanted their contribution to the healthcare ecosystem being acknowledged, insurance benefits provided, etc. But what is important to notice here is that this is only about 200 pharmacists in a larger ecosystem of some 0.75 million pharmacists around the country. The business models through which medicines are getting distributed are quite varied. You have a state medical corporation like in Tamil Nadu, or these fair price medicine shops, and then there is government provided Janoshadi pharmacy competing with these conventional pharmacists along with the private chains, and now we have the 1 milligrams and netmeds in the mix as well. So I would now turn to Shantanu and ask him from a perspective of a disruptive entrepreneur, where does he see the opportunity, where does he see the challenges coming from the 1 milligram perspective, and request Mr. Jesrani to complement as an investor in the ecosystem, given these feedback that we got through a conveniently sampled ecosystem of 100, 200 odd pharmacists. What does he see as the future of e-pharmacy in India? So Shantanu, over to you for about 5 minutes, and then I'll go to Sanjay.
Yeah, thanks, Chirantan, for asking me to give the comment. Very interesting study indeed. So congratulations to you and the team to this thing, and I think it's very, very pertinent. I think let me take the view of, as you correctly says, like coming from e-pharmacy. Yeah. So it's not that we didn't have our challenge. So let us see what challenges we faced on our side. We obviously saw a demand surge during the lockdown period because people realizes that all these pharmacies are locked down; they're not able to go. But major issues what we found is our ability to deliver because our supply chain were disrupted and even delivery chain was disrupted. So if we actually marry these two, the second thing is I will bring a little bit of a, not only from 1mg, I wanted to bring it from a customer perspective because my dad and my mother is diabetic, and so they buy medicines from 1mg and I help them to buy it because they can't buy it through an app. So typically what happens is that I actually put the order, etc. But what happened during this period, my mother needs insulin and they were not able to get it. So the point of they have to somehow get the procured from a local pharmacy. So point I want to make, and it also made me stop for a second, that look, if hypothetically, if we have only 1mgs of the world, and I saw the similar thing about by Big Basket, yeah, then what's going to happen? Suddenly everything got disrupted. Big buckets could not deliver, 1mg could not deliver. And if we didn't have the local pharmacy or local kirana shop, we'll be without food and without. So one thing is being an investor and one thing is being a consumer. We are all a consumer in healthcare. Everybody's a consumer also on the other side. So my other side told me, look, it can't be this model. Like, I mean, hypothetically, it's not possible. I know that a lot had to happen, but hypothetically, we'll have to bring a balance between the two, that whether, how can they two coexist, because they are providing a very, very important thing. In fact, this is exactly what I told to my company, that look, we'll have to figure it out. So let's see what does e-pharmacy do very well and what don't do very well. E-pharmacies work very well for chronic diseases. Like you have a set of medicine. You have diabetes, and like as I say, my mother needs 2 vials of insulin and other things, and then every month this is the time I consume, so I tell them that works well. It takes around 24 to 48 hours to deliver, but e-pharmacies don't work very well. At a very similar time, what happened, my son got suddenly a very severe pain. And I, being a doctor, I actually realized he was having a renal colic. And what I needed is a painkiller injection, and I need to get that delivered in my home. And being myself a doctor, I will do it. But otherwise, a normal consumer also need a nurse to come and do it. Yeah. So what I'm trying to make, that in acute cases where there is a requirement to deliver to medicine within, let's say, 2 years, 2 hours or 4 hours window. I mean, there are a lot of cases where I need medicine now and I want to go buy. So that cannot be replaced by e-pharmacies, So there is this need of the chronic disease and there is this need of acute disease, and this is where I see the opportunity to work together. So in first principle, I believe that for the betterment of the society and betterment of the ecosystem, both needs to coexist. B is what I feel is that how it can be work as a more synergistically. For example, the acute, there are a lot of people, and most of the e-pharmacies are not able to serve this short turnaround customers. And if they do, their cost is very, very high and they're not able to do it. So how can they use it? The local pharmacies, that could be one of the things. Third is the fact that you mentioned that there are a lot of issues. These local pharmacies have problem that they don't have enough SKUs, etc. Can you be your back end of that? You know, to some extent, what is you see the Reliance Jio is doing with the Kirana store. You know, so I think that's what my thought process is. The digital players will be actually enabler for the local pharmacies and trying to see who does what best. And finally, the customer or consumer, which include all of us, you know, we get the best value for the money and it gets served. So that's what I feel. And this, what this survey shows, that there is a requirement for working synergistically between these two segments. It is not going to replace one or the other.
Excellent. And Mr. Sanjay, you have been involved with this ecosystem from even pre-COVID-19 days. How do you complement with your thoughts on what Santanu said?
Sure, Professor. Uh, I'm happy to be here, and I quite agree with what Dr. Shantanu said. See, I'll take a step back and look at it. I sit also on the board of a cardiac hospital in Hyderabad here. So one of the things I always look at is that healthcare overall is moving towards a lot more of patient centricity, customer centricity. The patient has to be treated as a customer. So even as an investor, one always looks at what is a sustainable model, right? And I've always believed, I work with a lot of deep tech startups, and I try to tell the founders that your business has to be a mix of tech plus touch. Tech cannot take over 100%. If you are only touch, then you are not going to be efficient. You may not be able to scale. So even as an investor, I would look for a right sort of hybrid model, which is able to serve the right categories of customers. In fact, one of the inspirations which one could draw from is the group Best Buy, which is an electronics retailer in the US, and they have a concept called Geek Squad. So they survived the onslaught of Amazon and all the online giants by ensuring that they had sufficient amount of touch, where buyers of consumer durables had a free installation option where somebody from Geek Squad would go there and help the customer install a 50-inch LCD TV. I'm sort of going away to a different parallel, but I look at local pharmacies and e-pharmacies as a great combination. They can work together in a hybrid model. And finally, as an investor, what I always look for is the business model has to be efficient. You have to be able to deliver to the customer a cost efficient product in time, both quick turnaround as well as supply for chronic patient requirements, which are sort of pre-programmed. You can have a bill of material, you can have a frequency of that requirement, but you do it in a sustainable manner. It cannot be a gross loss pricing, which can run for some time and then it sort of, doubles in price and all the goodies go away. So that's not possible. So my takeaway is, I'm actually an investor in PlusPin and I sit on the board. My takeaway is, I think models like PlusPin, I consider startups as statins, which can actually bust through corporate cholesterol, as I like to call it. So startups like PlusPin can actually work very well in partnering large companies as well as heavily funded startups to eventually deliver a customer-centric model. That's my view, Professor. Back to you. Thank you.
Thank you. That's the coolest expression of welfare enhancing healthcare entrepreneurship activities I've heard. Startups as statins busting through corporate cholesterol.
Thank you.
I would now want to bring in the policy perspective here. Amrita Agarwal has joined us from the Gates Foundation today. Amrita, why don't you take over and share your thoughts on what all of this mean for policy, out-of-pocket ecosystem that we have, and for the future of Indian healthcare in a private-public composition. Over to you.
Thank you, Chirantan. It's great to be here with such an interesting panel. So, I'm going to talk about mostly the longer-term journey which the Indian health system is on, and how the last couple of months has really impacted the journey, and many things have really not changed, and we will continue to be on that journey. So, on the short term, I would say it's still to be seen how the consumer preferences and consumer behavior will be altered by COVID. There was a short-term blip, and we heard about that, which is hoarding, denial, foregoing care, pushing out care, etc. But if you see, then the long term, because of the economic impact, also there's going to be a drastically reduced paying capability of the consumer. And there may also be changes in the disease pattern. Long-term effects of COVID are still not known. There are temporary changes in channel preferences, but we'll have to see what the long-term trends on those things are. So I think that's one consumer preference story which still needs to be investigated and seen over time. There's a supply side story also on pharmaceutical. We all saw the shortages and how the pharma manufacturing upstream was not really linked to the downstream. And the uncertainties in the global supply chain have also really hit the policymakers globally. So a lot of people are thinking about how to re-engineer this manufacturing and supply chain, which will eventually have bearing for what gets produced in India, at what cost that gets supplied downtown. So I think these are larger order changes, and even India is thinking of how to make API self-sufficient. We will see the impact of these larger supply chain changes over the next 3 to 5 years, I would say. But there are things which are, some things which the Indian healthcare system and all healthcare systems have been grappling with, which is the traditional market failures, right? Which is the uncertainty of care, information asymmetry, the hyperbolic preferences of consumer. And there are certain things which most countries, well-developed countries, have done to overcome these market failures. No one has really solved it. And how does India really play the role in this journey? Now, will all the circumstances of the last few months help it or hinder it is something to be seen. So I would first start with the healthcare financing one, because it continues to be the major challenge, especially with consumers being hit economically. Where will the paying capacity from consumers really come from? If you look at the most developed countries, they have tried to reduce out of pocket. Now, India is stuck in the conundrum that we don't have enough tax financing. We don't have a formal labor which can be imposed a social health insurance tax. And frankly, the voluntary insurance market, which is always riddled with market failure, has not really developed, right? Like the insurance penetration, apart from government-sponsored health insurance scheme, is less than 10%. So by and large, we continue to rely on out-of-pocket. Given the burden of fiscal burden the government of India will have in just bailing out the financial systems and many other areas of the economy which are sorely broken, I doubt that we will have the paying capacity to become NHS in the next 3 to 5 years. So while the government has now been looking at prioritizing healthcare, and that's a very welcome change, COVID has done one thing which is really put healthcare on the map. The sheer ability of India to be able to generate that amount of tax financing will severely be impacted. We don't have a large formal labor market. Our formal labor is less than 8% of the population. So we cannot do what Germany did or Japan did. We cannot rely on the formal workers to sort of bail out the healthcare system and reduce out-of-pocket. That really leaves us either to make the out-of-pocket market more efficient or to really push for expanding the commercial insurance voluntary market. Now, every economist in the world will say that, hey, there's the twin problem of adverse selection and moral hazard. How do you increase insurance markets? However, there have been a lot of breakdown of how to address the failures in the individual insurance market, especially, Obamacare was one such attempt at that. But we haven't really begun the conversation in India. How do we really reduce overhead costs for selling insurance? How do we reduce fraud in the insurance market? How do we reduce mis-selling? And there have been papers by NIPSP, etc., to say that the consumer is getting us a short stick in today's insurance market. So, a bad product will not help expand the industry. Now, there is a lot of role where e-pharmacies and pharmacies, and I think of the offline pharmacies as a big role to play in increasing the insurance market, and some of it was referred in the study which you have shared. I do think that the skill set which the chemists and the pharmacy industry has is a very specialized skill set. And health insurance is a complex product. For versus the knowledge of risk of the customer base is maximum with the pharmacist and the offline or online. So there's a nice understanding of risk, there's a nice understanding of complexity, there's a nice relationship with the customer which could be built. Now, there's obviously regulatory barriers on what is the third-party channel for selling insurance, etc., that needs to be looked at. But I think what you proposed, I think, is a good way to really reduce the overhead costs and reduce adverse selection in the market when selling insurance. So that is one clear role with e-pharmacies, and especially offline pharmacies, I think, can play. The other evolution in the health financing system is that we don't have an integrated health financing model. We only are covering hospital and indemnity care. This is true for government-sponsored health insurance scheme. This is true for commercial insurance schemes. As we think about covering OPD, especially pharma benefits package, if you look at most packages across the world, they do cover pharmacies, pharmaceuticals, and OPD packages beyond the hospital stay. That will dramatically change how e-pharmacies and pharmacies will operate. Now, how quickly will that come in India? Now, we already have two schemes, CGHS and ESI, which cover OPD packages and pharmacies. However, those are not really managed well. So can they be restructured to become a use case of how we can do pharma benefits package properly in India? Potentially. And then how do we think about integrating the government-sponsored health insurance scheme, which is basically PMJY? And I know there's early stages discussions on how to integrate PMJY with primary care, which may be happening at the policy levels, but how do we really make it happen in practice? And in commercial insurance, if you see most of the policies, less than 5% of the policies have a OPD coverage. Now, there's legitimate reasons why that has not happened, why we are not covering OPD and pharmaceuticals systematically. There's issues with fraud, there's issues with high overhead burdens, there's regulatory issues on can providers also integrate and be payers. So we need to look at this more systematically than just a one-off. So if we have to unbottleneck this, we need to get the financing right. So that's, I would say, as we integrate OPD with the hospital insurance we have today, I again think e-pharmacies and pharmacies will have a critical role in unbottlenecking all the challenges we have mentioned on the fraud management, on efficient selling. So there, both customer relationship as well as digital capacities will play a huge role, I would say, in the coming few years. The last, but this requires an evolved policy landscape and evolved private sector to come together to make this happen. Moving beyond health financing, there's a service delivery aspect. And while we've been talking about service delivery, we have independent, many models of trying to do primary care models, which are oriented towards wellness, but many of them have not become sustainable and self-sufficient. And I know in your paper, you also recommend can e-pharmacies become digital wellness, and which is both offline and online. If you just look at the cost efficiency of the current operations, it completely makes sense to diversify and do cross-selling to other services. However, they also have the relationship with the local neighborhood. They also understand the risk factors of the local neighborhood. However, this is required to move away from a product mindset to a services mindset. For example, in COVID circumstances, many large condominiums or many rich people were buying oxygen concentrators as an insurance policy. Why did not every pharmacy in that locality buy an oxygen concentrator and provide this as service to the neighborhood? So how do we move away from the product mindset to a services mindset? Requires relationships. I'm sure
that particular thing, I would say, like the pharmacists in Hyderabad, at least we enabled them to do, and almost 50 plus pharmacies procured oxygen concentrators and serviced it to the customers through our supply chain piece.
That is wonderful. And you know exactly what you're doing. Maybe models like yours need to enable more and more pharmacies to move from products to services, because in the end, whoever owns a customer relationship can really keep adding on. So I think both what you're saying, Santosh, and what's recommended requires a lot of push to happen, and there the offline and online can come very nicely together. I would say there's another...
So, Amrita, we have to wrap up. If maybe in a one sentence, if you could just, because the doctors have been super patient. I want to definitely bring in Deepu and Ajay now, apart from Santanu. So if you want to just wrap up your overall thoughts.
So that's it. I would say there's a critical role for pharmacies, online and offline, to play, especially beyond the large cities to rural markets. There, if you see the consumer behavior, their behavior is to first go to the pharmacy to get the care and the pharmacy at the same time. Unlike the large cities where you're competing with doctors and hospitals, I think this requires reconfiguring the business model, and that's all I would say. So it's quite interesting what this space can evolve into.
Awesome. Thank you. Thank you very much for especially bringing in the policy perspective and the financing perspective issues here. And as we can evidently see, this is a complicated issue. It will take time to resolve business model wise, entrepreneurship wise, technology wise, and policy wise. So let's see what the end game looks like. Both Ajay, by the way, and Deepu have been a clinician, active clinician, and they have now turned entrepreneurs. And it's time for us to pay attention to their thoughts as well, because ultimately the prescriptions are being written by the doctors, and that is the key certificating agent through which medicines are getting dispersed. So I would request maybe Ajay to start with his thoughts. One of the things I would love him to chime in on is this conflict of interest issue, where if you can be a hospital provider at the same time you're a pharmacist as well as a digital wellness center, how should policy deal with it? And in general, given his large perspective with various experiments in healthcare as a clinician and beyond, how does he see this evolve? And then I will take in Deepu, because he runs this very active digital medicine platform called Daily Rounds. I would love to know from him, after Ajay, thoughts on how the doctors are responding to this digitization effort happening in this particular submarket in Indian healthcare. Ajay, over to you.
Thank you, Chirantan, and thanks for having me here. So maybe I can just start with, how I see the space. And we have to understand that when we step outside of major urban areas and as you go more and more rural, a lot of the healthcare delivery actually happens through the pharmacies. And these are not just regular pharmacies. This could be a person sitting under a tree with a box of drugs. And that is where a lot of the healthcare delivery is happening. And the status quo today is that, drugs can be fake. It could be as much as, 40 to 10% of these drugs could be fake. There's usually not really a pharmacist present at most pharmacies. There's a certificate hanging on a wall. There's also a massive problem that India has with the overuse and indiscriminate prescribing. I mean, both happens at the doctor end, also happens from the pharmacy, where you just have a tremendous amount of misuse of things like antibiotics. We've become the country that produces all these superbugs. I think COVID has, put us in the back. So anyway, so this is essentially what happens, on the field and on the ground. So to me, digitization through e-pharmacies or through, the kind of work that PlusPin is doing is very, very welcome, right? Because what you can now do is you can hopefully be able to track authentic drugs. You can actually, obviously all the consumer benefits that you get from any kind of online model exist, but you also have a lot more traceability. You just have a lot more, formalizing that space, to me, as far as I'm concerned, is very patient friendly, right? I think it ultimately will lead to better patient outcomes. Again, and this whole idea of moving to a services mindset, and in the US, you see minute clinics, and there are other models where pharmacies can do more services, which to me, again, makes a lot of sense, because there is this white space there, because we don't really have as many primary care physicians and providers out there, and maybe the pharmacy can step in and play that role. So to me, I don't really see this as an e-pharmacy versus brick and mortar pharmacies. I think, the pharmacy sector as a whole needs to start thinking about what more can it do for the health system in India and for the patients that they're serving, and that's really how I would see it. I do see a difference between, so to me, formalizing and making the pharmacies more compliant with regulations as well as broader standards is again good for the patient, right? I think there are challenges. I think what you mentioned in terms of the conflict of interest. So we also, for example, a hospital will run a pharmacy, a lab will also run curative services. There are ways to handle that, and the way to handle that would be to really separate these pieces out. Even within the same entity. So in a hospital, the pharmacy is, the pharmacy, or the Department of Medicine doesn't report to the head of pharmacy, right? So maybe even structurally within a company, you can separate these things out. And I know that a lot of players are actually thinking and talking about this kind of stuff right now, right? So to me, the conflict can be handled, I think, digitization. I think e-pharmacies are driving some of the digitization. I think brick and mortar pharmacies would not digitize as quickly if the threat of e-pharmacies didn't exist. I think ultimately you have to get synergistic play, and it is good for the system and good for the patient. That is sort of the bottom line. pipeline. That's how I sort of see it. I do think that it really needs to be a synergistic player. Both need to exist, and like Shantanu said, there are lots of things that a e-pharmacy will not solve for, and with healthcare, often you have urgent requirements, immediate requirements, for which you will always go back to your local pharmacy. The local pharmacy also has to connect the conversation with you to also be able to do a lot more with you than what an e-pharmacy can right now. So I'll stop there. I know that you guys hear me.
Hey, Dr. Ajay, I think the audio is a little bit grabbing from your end. Could you please check
Yeah,
that once?
something happened with the audio.
I think we lost the last 30 seconds of conversation might be.
Hi, is this better?
Much better. Go ahead and wrap up the last minute maybe.
Yeah, so I'm just saying that I think that digitization through e-pharmacies and like what is happening in the ecosystem, I think is good for the consumer and the patient. I don't see it as a debate between e-pharmacies and brick and mortar pharmacies. I think pharmacies as a sector, whether it's online or offline, need to start doing better for the patient, and that is frankly what a lot of technology will allow.
Awesome. Thank you. Deepu, why don't you take it up and share your thoughts from daily rounds more broadly?
Yes. Thanks, everyone. Good to be here. I have a bit of a contrarian view here, and I would bracket it into 5 points. And I will stick to the heading only, which is basically clinician perspective of the future of e-pharmacy. The first point is that, see, we have to see a clinician or a doctor as a small business. At the end of the day, if the doctor is not working in a government sector or a tertiary care, he is essentially running a small business. Right? So he has all the challenges of SMB in India. And now let's take the typical example of an individual clinic, a doctor who is actually sitting alone and practicing. For him, the pharmacy is a component, which is actually, it's a very important component in his workflow. And that's when he actually completes workflow. And typically it happens with a neighborhood pharmacy. So it almost always makes sense. And it's a very personal relationship that happens to him. Now, this same doctor, imagine, he scales up. He have a small setup on his own. One of the first thing he would invest in is a pharmacy in the hospital, because it's a great add-on revenue. The first lateral revenue he's going to get is actually from the pharmacy, right? And of course, he has the capex, the payroll, and everything too. So this pharmacy revenue is also very important. And of course, when it goes to a hospital, I don't need to say that. That's also pretty important that the drug revenue, the pharmacy sales are also important. Right? So the first challenge I see from a clinician perspective, there is no incentive for any clinician to be, be in an online e-delivery. And that's actually a very important point, because most clinicians do not make a lot of money, right? You remove the 95th top 5%, all of them actually barely make decent wages, in their 30s. So incentive is a very important thing. Now, I'm not going to the moral, ethical part of it. Can they get a affiliate commission from a pharmacy, right? That's a different discussion. But at the end of the day, they're running a business. So the biggest challenge, my number one point is that the entire e-pharmacy model by default doesn't have any incentive for an individual practitioner, for a group practitioner, and for a hospital. And in fact, it's a negative incentive, right? So at the end of the day, you're taking up that part. The second thing is that, the second point here is that this is not in my workflow, right? Again, I do not actively practice right now. I run a platform called Rounds and Nair, which is practically used by almost 80% of Indian doctors. So I'm kind of speaking for them and my colleagues. See, this e-pharmacy right now is not in my workflow, right? It's not in my workflow, right? I prescribe a patient and something, and I give the cheat, and it goes to, it's the best thing is to go to the next pharmacy where I know that medicine is available, right? So since nothing is digital, right, this one piece cannot alone exist as digital. The third point, which is again not so favor, is the quality issues. I recall when I was practicing, there was Coimbatore pharmacy, there was Erode pharmacy, all of them giving generic medicines in like 1/5 of the price. But the problem here is that the drug is my only weapon, right? And for most physicians, that's my end tool. So if I cannot have 100% assurance on what my drug will do, like I give you a paracetamol for a headache, and the formulation actually has only 80% efficacy, that's affecting my entire career, right? So the quality issue, I have less and less control, right? So, I mean, of course, the best thing about E-Pharmacy is that it offers the consumers a choice. You can, sort according to the lowest price and pick up. So the downside for the doctor is that you're losing control and you have the trust issues. And so that's my third point. My fourth point is that, see, there is always this trust issue with the platforms, right? Right now, Google and Bing had the issue, right? Now, the doctor appointment sites, they want to do the platform play, right? So everybody want to do the platform play. Now, platforms use so much of their marketing dollars and, force to kind of bring people. So like, my products, Marrow and Daily Downs, both of them are dependent on Google as a platform, because Google has such a big power. Now here in healthcare, I believe doctors, since they are essentially quite a lot of decision maker for the industry, the power dynamics is still very much evolving. Right? So doctors still feel that I don't need to give my data, I don't need to give my patient, I don't need to give my drug prescription data to the thing. And now they're increasingly realizing over the last 2-3 years, very increasingly realizing that I don't want to leave it to someone else, because then I'm losing this with them and they're going to commoditize. So that conflict is always there. I think very importantly, sorry if I lost you there. One thing, and finally importantly, what is the value add, right? So unlike a e-commerce play where there is, see, obviously price advantage, but that's for the consumer, right? So for a doctor, the price advantage is not something which would make. Availability is not an issue. There are so many small shops, medical shops, all of them, and these are all SKU products which are can easily distributed. So the pain point is also not very strong enough. So these are my bracketed points. Now I want to say then what's the point, right? I mean, why do you even think of clinician to build this business? Why don't you bypass clinicians and build a B2C business, right? That seems to be the best way to do. But the reason I'm raising the point is that, see, for example, I know that a few of the e-pharmacies have a very strong business with the distributors, right? They enable the Kirana medical shops. So you need to have certain moat. I mean, otherwise it will become a commodity business where Amazon and Reliance, you need to have a moat. And this moat, one of it can be, you have a backend strength. And one of the moat can be you are very strong with the clinicians, right? But I don't have an answer how do you build the moat. But, if that moat is there, there are a lot of things to be fixed. You can't just keep looking at B2C because it's, the physicians, a million odd physicians are influencing 80% of the purchases, right? If you remove OTC out of this entire category, the purchase decision makers are physicians. So it's very tough to kind of ignore. So this would be my point here, a physician's perspective in the entire future, to put it somewhere.
Superb. Thank you so much, Deepu. I think those were a nice conclusion to the initial interventions by the panelists. And I'm glad we are talking about it from a multi-sided perspective, because the broad sense I'm getting is it's not just a two-sided platform, but it's a multi-sided platform. There would be issues on business model evolution, issues on investorial tastes and preference evolution, policy needs to be more dynamic over time. And then we will also have to figure out the financing aspect and the quality aspect, while keeping in mind that one of the key agents in the system in resolving the information asymmetry and the trust deficit that potentially exists around healthcare in India today is indeed attended to in such a multi-sided disruption. So I will now turn to, we have about 5 more minutes for the panel, and maybe we can take 3 more minutes by spilling over. But I'll now turn to some questions that have been raised by our participants. So Gopi Krishna Panikar has asked, should e-pharmacies actually adopt a B2C model for chronic care and a B2B model for acute care, in which they serve brick and mortar pharmacies with an assured supply? I think Dr. Santanu, you may want to take that question because you raised that example personally.
Yeah, I think that's what I was alluding to, that look, while you work on this, there's a chronic disease, we have a good control by the long, and then there are economic advantage you can bring, because basically you actually make more predictable. So I can actually give much more discount, not discounted funded by investors' money, real discounts, which I can create by operational efficiencies. So that's where I think that were, and then, but the end of the, from a customer side, I will not be then this is not a full one-stop solutions, right? Like I will, for chronic, I'll go acute there. So can we work together with local pharmacies and make it a one-stop solution? And the second is, see, pharmacy is one part of it. Some of the things what I was hearing from Dr. Deepu, my answer would be this. So let's come back to the patient side. Yeah. So patient, I used to run a primary care clinic chain before 1mg. Yeah. So when I started, I came from NHS. I said conflict of issue. I will not have a lab. I will not have a pharmacy, because moment I do that, I am more skewed towards providing those, doing more tests and things like that. And so I was like idealist, and I said, look, that's not going to happen. It will be a pure play consulting only model, which is most of the NHS GPs do. There are the exception, but 90% do a consulting on the model. But what I realized, forget the conflict of interest, patients were asking for one-stop shop. They will say, why should I come to Nationwide? Next door, Columbia Asia provide all the three. So what patients, so I think we need to come back to this patient-centric view of the healthcare. Everybody has their own sick. Patient-centric view is that I come in one place and I do this thing. So second thing I would, somebody just mentioned about telemedicine. I wanted to tell you that I have extensively traveled because of this telemedicine and like how do you provide primary care in rural area. So I saw one model where they are running 500 clinics, where one doctor, who is an Ayush doctor, is in the front and there is a qualified doctor in the back. Now I was sitting in that village and seeing some consultation, and somebody says this consultation is done. And then the doctor in the back says, I think this guy needs to get a cholesterol. And then I ask, what happens now? Where does he get a cholesterol done? He said, now he has to go 20 kilometers to get a cholesterol done. Everything breaks apart. So you have to think that one-stop solution. So coming back to this, look, how can you work with the doctor? In fact, we do this in 1mg with provider, I would say. I'll say, look, if you're a, let's say, chronic disease patient, patient is coming for diabetes, he buys from your shop one time, but actually he buys 3 times from a local shop. Yeah. Secondly, you write blood tests, most of them has to be done fasting. So he's done locally. So how can I capture the complete life cycle value for you? So I become your e-pharmacy. So I make sure that I provide the app, etc., everything for you, and the patient actually choose. Like it looks like that doctor's e-pharmacy and e-lab. Because coming back, look, pharmacy is one piece, lab is one piece. I give a complete e-digital clinic solution where patient might have come physically one time, repeat might be bought it from this thing. So give a one-stop solution and work together with the provider and try to capture the whole value thing. And
Thank
so
you,
I think that's the way to solve it.
Yeah, Amrita had to leave, and I want to take the telemedicine perspective from Ajay also, because he's doing Swasth. And he has been very mild today, but he's actually doing quite influential work with Swasth. So I would love to see his perspectives complementing what Deepu and now Santanu said on the role of taking, like you are like basically creating an integrated platform for healthcare with a patient-centric mindset. And the guidelines are also still evolving, as someone has said. So any general thoughts here, Ajay, as to how this all complements or substitutes the future of e-pharmacy and the patient welfare perspective?
I think, telemedicine makes a lot more of the e-pharmacy business possible now, because you're able to actually get a consult and get a prescription from somebody. I think that, we just have to be careful in terms of these incentives. You have to be careful in terms of, because you can't have a doctor being incentivized to drive prescriptions, right? And that actually happens. That happens across the country, in brick and mortar settings. But I think when we are creating a new system, we should be very careful about how these incentives are aligned. Because we also have, I think, for example, the opioid crisis in America was almost entirely caused by poor prescription practices.
Exactly.
Not through an online model, but through a regular poor prescription practices and poor incentives, right? So I think we just have to be very, very careful about how these incentives align. And especially when it comes to the prescription, I think the physician needs to continue acting as a patient fiduciary, and that ultimately is the role of the doctor there. And no matter what mode, whether telemedicine, online, offline, I think that needs to continue to happen.
Okay. This is probably the time to wrap up. So maybe your last thoughts on the future of e-pharmacy and more broadly digital healthcare in India. I'll start with Sanjay, go to Deepu, come back to Shantanu and Santosh, Gopal, and then request Ajay to take the floor and wrap up the conversation. Maybe like a minute of your thought, and then we'll wrap it up.
Yeah, thank you, Professor. I think a lovely discussion, and I come back to that. There is a lot to be done. Our per capita spend is only $50 right now, so there is a huge amount of scope, and patient centricity and value will have to drive everything, Professor. Back to you. Yeah.
Shantanu?
Yeah, I think we are living in a very exciting time. Digital health has, we have been talking for a very long time. It hasn't delivered the way we wanted. But I think 2-3 events, I think COVID has become a boon for us. The regulatory changes are happening. And we see that people are taking more and more digital health. But one thing I would caution, I often talk to, I am more of a clinician than become an entrepreneur. But I see the technology world always come up with a solution first and try to fit it. You know, I say to start from the other end, start from the problem end. So I always worry about this, that I have found a national digital health mission. Now let's fit it. Let's not start that way. Start with the problem. How do we deliver? What is the problem? Let's national digital health mission solve it. So I am yet to get that confidence.
Super. I actually I'm aligned with you on that thought. Deepu?
Yep. Yeah, so it's still very much evolving, the business model part, because so far a lot of these models are primarily looking at the US, where the Teladocs of the world are there, and even in China, right? So I feel Indian healthcare is very different and in a very paradoxical way. The e-service access is quite much in entire 2, 3 and cities. There are quite a number of doctors who are coming out, and we might actually have a surplus doctors in the next 5 to 6 years. So, and out of pocket is around 80%. So with all this in mind, I think probably with the COVID, the froth will go out of the system and a viable business model will come out, right? And then I think that's going to bring a lot of change.
Gopal and Santosh?
Yeah, sure, Professor. So I think just to put one line, we really have to look at to work at the grassroots level, whether it could be the e-pharmacies or the brick and mortar. We basically need to create a support mechanism at the grassroots level so that the problems of the brick and mortar can go away and e-pharmacies can basically find a lending hand into it. So there has to be a middleware, and the middleware should have a evolving business model plus the capability to bind things in. I think that's what.
Thank you for reminding us about the technology language. We are forgetting about hardware and middleware and all that. Santosh? We can't hear you.
I would just like to add one point is that obviously any such model or maybe like we are. Sorry, can you hear me now?
Yes, all good. Go ahead.
Yes. Yeah. So whatever we discussed in the paper or whatever the future runs is that we are not even telling that we will be probably basically bailing out the entire pharmacy space also on the brick and mortar part of it. But we see that there's a significant portion of it, 60 to 70% of them who are willing to change and want to be the enabler for the next wave or the next phase of the Indian healthcare ecosystem. So anybody who wants to work at a grassroots level with those pharmacies, we should probably target those top 60 to 70% of the pharmacies who are in for it and then help them grow to achieve these goals.
So there's a heterogeneity you are saying that should be leveraged while keeping attention to patient centricity. Ajay, your floor is yours to wrap up the panelists' thoughts.
Since we're talking about India as a nation, I think a lot of our conversation right now is about the top 50 to 100 million people, which is who most existing large market players serve. And to me, I think what COVID has demonstrated is that we can't build these sort of gated communities and live. We need to really care about the health of absolutely everybody in the country. And to me, technology is an enabler, but I completely agree with Shantanu is that we can't, it can't be tech first and then try and fit it to a solution. I think there are multiple issues that we have in the health sector. We have a lack of infrastructure, we have a lack of human resources, we have a lack of credible financing options. We have quality issues that are again all pervasive, whether be it service quality or product quality. I think it's fairly challenging. And now what has also happened with COVID is that a lot of the health sector is frankly devastated, right? Like if you look at small clinics, nursing homes, it's actually a fairly tough time, not just dealing with COVID, but beyond that too. So I think we almost need to sort of rise from the ashes and build a new health system that works not just for you and me and people like us, but works for the rest of the country. And I think technology will be a key enabler, but I think exactly how it works, we need to collaboratively figure out. I don't think it can be, there's no master plan that one person can write in a dark room and then come and show it to everybody. I think it's a collaborative thing that we as the industry and as a country need to start doing.
Amazing. Thank you for sensitizing us to the rest of India and not just us who have a privileged life that we are leading on Zoom. And indeed, it's for that India as a country why we are having this webinar. My job here is basically to summarize these thoughts and mention the role of the regulator and analyze the regulator's actions as well as an economist. So I hope that all of these conversations are translated into better business models, more agile and, as Ajay mentioned, collaborative policymaking, and also while not forgetting the role of technology. Technology is the complementer here to solve the key pain points that is there at the base of the pyramid. So with that, I really appreciate your time on the Saturday evening for this webinar, and I wish you all safe and good health. And thank you everyone for your great questions. Some of them are rhetorical, so I didn't take it back to the panelists. I think the answers were already given out in their interventions, and I wish you all good luck. We'll end the webinar at this point, and wish you all my best. Thank you very much. Bye-bye.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.